Unity Health Toronto is one of the largest Catholic institutions and teaching organizations in medical science. Our work basically promotes sustainability and reliability, especially working for a healthcare setting where our work directly impacts the well-being of our patients. It's a role that comes with great responsibilities.
I always wanted to help people. Although I'm not working frontline, I don't save lives directly. But what I do on a daily basis, I improve the infrastructure. I'm helping the patients to recover in a more comfortable space. I'm reducing costs for the hospital operation, and that money goes back to the patient care.
Emily and Shailesh embody the missions and values of Unity Health, and that is what drives them, and that's their motivator. They fight for what is going to be the best for the hospital, and they're always putting that first, even before themselves sometimes, right? And at the end of the day, they make me want to do better. This team really wouldn't have started without the Energy Manager program. Once I sort of dived into that world, I realized how much bigger energy efficiency really could be.
I think one of the projects I'm most proud of is the lighting retrofit. We replaced over 16,000 lamps across 3 hospitals, and the associated utility cost reduction is more than $300,000 per year.
We have seen a significant reduction in our utility usage across all 3 sites. Since the inception of our team in 2019, we have saved about 6,000 megawatt hours of electricity and over 400,000 meter cubes of natural gas by implementing certain waste heat recovery projects. The IESO and Save on Energy incentives basically have helped us bring our payback down to a level where the projects get approved right away. And given the age of our buildings, like some are 100-year-olds, some are 80-year-olds, so every day there is a new challenge, and every day there is an opportunity to improve the system to make our hospital more green and more energy efficient.
From playing in a small sandbox, we're looking towards how we can make a bigger impact through the larger projects, through the long-term planning. Those projects will last for 25 to 30 years. I want to look into how we can contribute to the net zero, and I want to build the best energy management system in healthcare.